Let's look at lateral headache. Lateral headache. So we still can use Lingu Dabai, even though Lingu Dabai, as I mentioned before, doesn't have a specific affinity with the Xiaoyang. Right? Remember that? If we looked at all the channel associations, it's really hard to get large intestine and maybe lung channel to get to Sanjiao gallbladder. Right? And lateral headache is really looking at like gallbladder headache. This is the typical like migraine type of presentation. That said, Lingu and Dabai together are so effective for head problems that we can still needle these points, but we definitely want to combine with some other point that targets the Xiaoyang zone. And the next 2 points, the Zhongzhou means middle 9 miles, and Xuechu means water curve, water bend. These 2 points are both on the gallbladder channel, so they do focus in specifically to the Xiaoyang area on the head. Okay? So we can use Lingu and Dabai, but we're going to be wanting to combine them with other points that help bring us into the Xiaoyang. Let's look at these 2 points. Zhongzhou means leg 9 miles. 88.25. Zuzhou means the leg 9 miles. This is a Dao Ma group. The Dao Ma group itself is comprised of 3 points: middle 9 miles, upper 9 miles, and lower 9 miles. The middle 9 miles is located where the tip of the middle finger touches when a person stands erect, which is the same as gallbladder 31, right? This is the same as Functure, Wind City, gallbladder 31. So this is an overlapping point with gallbladder 31, and I'm going to suggest to you that you can palpate that area for sensitivity, right? I find that that area oftentimes becomes quite sensitive when it becomes a reactive point. So you can palpate up or down right over the bone. My experience is also we will frequently see small clusters of spider nevi, especially for more chronic cases. So for the more chronic migraines, this is one of the points we want to choose. So that notice the difference here between the zones. Here we have zone 2. Zone 2 is good for acute pain. This is zone 8. Zone 8 is good for the more chronic type of thing. So for chronic migraine, the combination of the two is very good. Right? Doesn't mean, just because this is acute doesn't mean you can't use it also in chronic cases as well. But we definitely want to add in something like this. This is zone 6. This is on the foot. So if we have more of an acute condition, then we don't necessarily need to do the zone 8, right? Unless it's particularly sensitive on palpation. Does that make sense? Okay. So the zone 8 we will frequently see in this area of gallbladder 31 a cluster of small blood vessels. And I think that when you see that, then you can, even if you're not doing bloodletting, it doesn't matter. You can needle in the area where you see the cluster of small blood vessels, even if it's not tender, right? That's another aspect of reactivity. The upper 9 miles is 1.5 Tsun anterior. So it's on this horizontal line, 1.5 Tsun anterior. The lower 9 miles is 1.5 Tsun posterior. The main point is the one in the middle, but you can add 3 points across if you want to sort of augment the effect. This brings us to a question of Dao Ma needling that we'll address very quickly. The Dao Ma needling, some authors who write about Master Dong's acupuncture have said that Dao Ma needling is only along channel lines. Right? Like we saw Lingun Dabai are along the large intestine. Or the example I give you, pericardium channel, pericardium 6, 7, and 5, along the pericardium line. And that across channels is technically not a Dao Ma group. And I would beg to differ, because here we have anterior on the gallbladder channel and posterior. This is clearly a horizontal Dao Ma group. So we can needle across channels, we can needle along channels. We can even do the 3 basic methods of creating a Dao Ma group: along channels, across channels, or in a triangular pattern, which means 2 points on one channel and 1 on a channel next to it. Right? And we'll see tomorrow when we do lower limb problems, we'll see more examples of triangular Dao Ma group combinations that are fairly common in Dong's acupuncture. Okay. So this This group of points, it benefits the chi and treats the blood, free and disinhibit the joints, right? So they treat pain and stiffness in the joints. Lots of pain indications again. Migraine, so the typical lateral headache. You can use it for all sorts of other problems, low back pain, cervical problems, another facial paralysis. Lack of strength in the nerves, shenjing wuli. So this is a description, lack of strength in the nerves. In Japanese it's called shinkei shitsu. In direct translation, the original translation was neurasthenia. Neurasthenia, think of all of the problems that Freud's patients suffered from. They were fairly wealthy and they just had like stress and they were just so exhausted all the time. That's neurasthenia. It was thought to be weakness of the nerves in that day and age. Neurasthenia is no longer a psychiatric diagnosis. But basically it's a stress. They're just stressed out. What's the connection between gallbladder channel and being stressed out? What channel connections do we have? What's that? Gallbladder and liver are interior, exterior paired. Very good. What other connections do we have? Anyone online, Donna? Right. So we also have Shaoyang gallbladder with Shaoyin heart. Right. So the gallbladder has a heart connection too, as well. Some people pop that up there online.
Yeah, after you answer.
It's okay. Close enough. They were thinking of it in the ethers, right? So this also is a good point. Another reason why this is a good point for pain all over the body, because it does address the heart. Remember what I said before in the Suen, it says all pain is subordinate to the heart. Right? Suen chapter 74 says this. So one of the ways we can address the heart is by choosing points on channels that have corresponding associations with heart.